Hello Silver members, it's Andrew here. I hope things are going well for you. Today's topic is looking at the effect of Western pharmaceuticals. Now, many people on the Silver program are taking Western drugs or have taken them, and if you're not at the moment, then most of us in some time in the future are going to be faced with the question, well, okay, Western medication is one option that we have. So it's important to be very clear about the impact that this is going to have. And the way that we get great health is by asking the right questions when it comes to Western pharmaceuticals. What we need to be doing is really thinking very carefully about what these medicines are actually doing and how are they achieving the effect that we want them to achieve. So I'm not just talking about the physiological action of a particular drug. Let's, for example, talk about an antibiotic, because that gives a very clear example of the point that I'm trying to make. So if you're suffering from recurrent ear infections, or it can be any infection in the body, it can be an upper respiratory problem, a gut infection, any sort of infection, and you've been taking antibiotics. Now, what that will be doing is, okay, it kills the bacteria that are present in the body, and so you're getting rid of the actual bug. And then what often happens is, as a result of that, you get an improvement in your symptoms because the bacteria is no longer there and no longer having its effect. Okay, so you've got to ask, is this what I really want to be happening to my body and to my health? Is this nourishing to my health? So if we look at this situation in a little bit more depth, we've got to ask the question, why is the bacteria there in the first place? Now, it boils down to the fact that the immune system isn't dealing with it well enough, and so that the bacteria is overgrowing and spreading and having a great effect on the body. So do the antibiotics actually help to strengthen and promote the immune function? The answer is no, they don't. That's not the action of antibiotics. They're not going to help to fortify the immune system at all. So the question is, what do you want to be achieving by taking antibiotics? If you're looking at actually beginning to correct the problem that's occurring, which is a weakness of the immune system, then antibiotics aren't going to do it. Sure, it's going to relieve symptoms, but there are other things that can relieve symptoms as well, and certainly other homeopathic and herbal medicines that will work, in my opinion, more effectively in terms of symptomatic relief. So these are the sorts of questions that you need to be asking yourself when you're taking any sort of drug, not just Western pharmaceuticals. These questions apply to taking homeopathic medicine, and I would encourage you to be asking these questions either to your practitioner, to me, and getting answers so that you have an appreciation, an understanding of what this particular therapeutic substance is doing to your body or to your mind, and is this achieving your health objectives? Very important questions to ask, because when we're on a longer term treatment program, as you are with the Silver program, then those of you who are on Western medication, or who are going to be faced with a decision to go on to medication or not, or to use some other way of treating it, you're going to have to ask these sorts of questions. And it's having knowledge about this that puts you a step above the average person, in a sense, who is trying to look after their health in a more educated way. So understanding what this drug does, what this particular medicine does in terms of how it helps you to achieve your ultimate health goals, it's a very, very important issue to consider. All right, I hope that's helpful. It's something to think about, isn't it? It's something that we all need to think about. It's not always easy making these decisions and getting the answers to these questions, but I hope that starts to point you in the right direction. Okay, we'll look forward to speaking with you soon, and I'm sure I'll talk to you at the centre fairly soon. Bye for now.